Okay, so good morning, good afternoon. I hope everyone is doing well, and thank you so much for joining our Bellabaci training on our cups today. I do have a little non-cup related item I am going to show you today, which I'm very excited about. So my name is Yurisma. I'm one of the international trainers at Bellabaci. I'm just letting a few people that's in the waiting room come in as we go along with this training. If you do have a question, either pop it in the chat box or just go ahead and unmute yourself as we are going through the training. And please go ahead and ask that question immediately. For those of you that know me, you can hear that I am having a little bit of a voice. So I do apologize for that. But I have a little bit of the flu, but I will do as well as I possibly can with that. So just excuse that part of the training for us today. And I think we're going to go ahead and start with a little bit of a demonstration, because one of the things I often get asked is, how do I incorporate it into my salon? How do I put it on my treatment menu? How do I advise my client to do it? And is it difficult to do? So I think you can do this in two ways on your treatment menu. I think that's the most done and the easiest way. So you can either do put it as a full treatment on your treatment menu. So you have cupping on your menu, whether that's a full body massage or a back, neck, and shoulder, however you want to add that onto it. So you've got it on your treatment menu as the Bellabaci cupping massage. And then, of course, you can use our signature genies or balms in conjunction with your cups. On that note, yes, you can use the cups with other balms or oils, but we don't guarantee your cups. We've got no idea what's in the other products that might be harmful to your cups. But they do work with other products as well, and they are a standalone product. However, when you combine them with our fantastic oleo genies and balms, you get the aromatherapy, the homeopathic results in combination with cups. So that's the way you're going to get the best possible results. And on that note, yes, your balms, your genies, they are also an alone standing product and work really well on their own as well. We don't have to combine them. And the second way is to put it as an add-on to an already existing treatment, or an enhancement to an already existing treatment. So if you just want to have massages, for example, as we're doing a body demonstration today, or even facials, and you do an add-on or an enhancement of cups to a specific treatment. It doesn't necessarily take any longer to perform that treatment, as it will generally replace a part of it. So you'll have a combination of hands and cups on the body, which we'll show in a minute. And the face would be the same thing. You'll have a combination of hands and face, and it will generally slot into the massage part of the facial anyway. So that's two ways.
Up in my room, like I see you in. I just didn't know you're.
I am just going to ask that you unmute, that everyone else does mute themselves
down
for
here.
a question. Let's just see. Sorry, I'm just going ahead and admitting a few more people here. All right, so that's the easy part of it. And now I'm going to actually show you on my model that I've got today a little bit of the back treatment of the cups. And I'm going to use one of our balms with that. So just give me a second so I can just align and you can see the body. Looks good. So today I'm going to be using one of our balms. For those of you who have not worked with our balms yet, they are absolutely amazing. As soon as you start spreading them, they have a fantastic slip. And I was asked this morning, actually, is the formulation the same? Is it the same strength? Does it work the same? So yes, yes to all of the above. It is basically the same formulation that we've always used for our genie oils. We've simply put it in a balm form, which has really had such great feedback from it. You also use less balm than you would oil, which means it is now even a more cost-effective treatment. And it's always been really cost, now it's even more. All right, so of course you'll start off with a nice effleurage. You can also do your kneading all over the body. And then we're going to go in with our cups. So for today, we've got 2 cups that we're going to be working with. First is your body cup. Your body cup has a soft and a hard strength cup. And then you also have your super cup, which is available in a soft and a medium strength cup. The easiest way to take care of your cups is just to wash them after every single use in a liquid detergent soap that you would wash dishes with. But we also have a list of things that you should look out for when you do work with the cups with them, like things like mineral oil that actually harms the silicone, those types of things. But easiest way is to just wash them after you've used them with lukewarm water. So your first movement that we're going to be doing, before I start with the movements, there's 3 different hand techniques that we often make use of. So first is your L-shape hand technique, where your cup would then be in that area. So that's your L-shape hand technique. Then you've got a U-shape, which obviously the other hand just comes alongside it, and it becomes a U-shape. And last but certainly not least, and this is probably the one you'll use the most, is a triangle. So it's closed in the front, close the back. The one thing I find we should just be a little bit careful with is do not squeeze the hands, because then you're squeezing the cup, allowing the suction to come out, and then you don't have the suction that you think you do. Okay, the first movement, which is called your cup effleurage, you can do in 2 ways. Either the L shape. It's also important that you squeeze the cup in the air, and then once you've squeezed the cup in the air, then place it on the body, release, and then you can continue movement. So the L shape, your other hand is open to assist with a little bit of, just to prevent it from falling. Or you can do the triangle, which is what I prefer, because then there's more hands and cup combination on the client. There's also no reason or need to lift the cup between every movement. Of course, I do because I am talking, but you can simply go from left to right, etc., or into the next movement. So our next movement is going to be draining, and so we're going to be draining from the midline outwards. And if you want or need to, you can step to the side of the bed. So if you have, or if your cups keep on struggling and you're just losing suction and you're just having a hard time, really, there's 3 things that you can look at. Number 1, are you moving too fast? And that's probably one of the things that is quite often. Just slow your movement down. The cups work really well, and it actually works better when you do your movements, slow massage-like movements. I think we often move faster because the cups are so easy to use. And you go as far into the neck as possible. The second thing you'll look at is, do I have enough oil? The oil or balm that we use is the glue between the cup and your skin, so it's really important that you've got enough. And last but certainly not least is, do you have too much suction in the cup? Your suction is determined by the amount of squeeze you give the cup. So that's about a lot. Sorry, let me just turn so I can actually see. That's about the medium squeeze, and then of course a strong squeeze. All right, so your next movement is circles. Simply going to squeeze my cup, place it. I'm using my triangles. For circle, I'm also dividing the back into 3 sections: upper, middle, and lower. And we're just going to perform circles on each of that area. I'm just going to, for the very last part, I'm just going to use the L shape for today for this particular client. Okay, from there, we actually have one of my absolute favorite movements. And I'm just going to swap over to my super cup because we're going to work directly over the spine. So there's very, very few massage movements that you can work directly over the spine. And this is one of them. And it's because we're not pressing down, but we're actually pulling away. So squeeze my cup. And for this one, I'm going to use my U shape. And we're just going to go down. Your hands can still do a nice pressure on your rectus spinae muscle. And once I get to the bottom, I'm just simply using my index finger around the cup and I'm just pulling upwards. And because there's not a lot of things that can work directly over the spine, this is so relaxing. You're working on a lot of nerve endings. You're loosening up the spine. One of the things that a lot of people will mention when it comes to cups is that it feels so after the treatment, except the fact that you have to go to the bathroom. They always say I feel so much more mobile, more looser, that I can move and I can turn and more flexible. Okay, so that one is one of the movements you'll perform 4 to 6 times on the spine. And so I often get asked is why do I use the super cup? Simply because it is a larger in diameter and it can work nicely over the spine. And as I'm using it today, that will give you some guidance as to which one you'll use where. But we always have to think of our particular client in front of us and adjust it to that client and what that client needs. Whether you are using the soft, hard, medium cups, body, super cup. Okay. So I've actually moved to the side of the bed for the next 3 movements, which is basically called your fish bites, your boat movement, and your vibrations. And the reason for this is if you're, it's just a much easier angle to work with the cups at. So if you are right-handed, you'll step to your client's right side. If you are left-handed, you'll step to your client's left side. And you can do both sides of the spine from that one side. Okay, so what we're going to be doing today, my first one is the fish bites. So my hands can do a nice pressure on the client's erector spinae muscle, same like with the thumb here. And your right hand in my case, will then be doing the work. My left hand will simply move upwards. So I'm going to do fish bite. Fish bite movement is basically where we would go squeeze, release, squeeze, release, squeeze, release. And that's exactly what I'm going to be doing. Squeezing, release, squeeze, release. Actually, can you, Tuesday, can you maybe let me know, Tuesday or Kirsten, if you can see this angle, or do I need to move to the other? Maybe let's just move to the other side. It's also not a hungry fish. It's a lazy fish or a full fish. So it's a nice slow movement as well.
I think it's fine, Jersey. Sorry.
Is it fine?
I think it's fine. Yeah.
Thank you, Tuesday.
I think. Uh-huh.
I can move a little closer as well if you think that would be better. The squeeze action should also not be super fast. It's also a, maybe think of like the waltz. So it's like a 1, 2, 3, 1, 2, 3, if that's how you would do the waltz. All right, so then your next movement is your, actually, before we continue, your fish bites you can also do with your super cup. And in this case, it would be like holding a burger, and you're going to place it on the client's body and make sure that this part of your hand, where am I now on the camera? There we go, is also touching your client. All right, so squeeze, there we go. And then I'm going to use my hands and the cup in connection with my client. This is particularly really nice for a client that's maybe a bit more muscle. It works really nice because it does go a little bit deeper than what like your soft body cup would go. All right, so then next movement is the vibration. And so you're simply going to jostle the cup as you move upwards.
Okay.
I always say this is almost like coloring in and not worrying about the line. And if you're doing this movement correctly, you'll definitely feel your own bingo wings moving as well. Okay, from there we're going to go into our boat, which is our final out of these 3 movements. And I'm simply going to twist the cup. A lot of my therapists would prefer calling it the twist, and that's fine as long as you do the movement correctly. But this is also one of those movements. If you do it too fast, it really doesn't feel that great. It needs to be done slow, relaxing, and that's also how you get the results. And so my right hand is simply twisting the cup and the left hand is propelling it forward or towards the neck. So your next movement is then your figure of 8. And I like standing at the top of the bed and using the triangle movement. Again, dividing the back into your 3 sections and doing a figure of 8 on each section. This is almost like very nice, calming and, excuse me, calming and smoothing after you've done a lot of that work on the muscle of the spine, the spine muscle. You can also, if you are perhaps like a shorter therapist, you can also stand on the side of the bed if that's easier for you. And then let me just do it quickly from the top again. The movement is exactly the same. It's just from the side and from the top. Okay, and as you can see, like where we've worked a lot on, my client is already going a little bit flush, a little bit red here. And that just shows us that circulation is being occurred, and that's 100%. If you find, so our basic thing is, or what we get asked a lot is, what about a cup kiss? What if my client doesn't want a bluish mark on them? So we call it a cup kiss. And because we specialize in movement cupping, they really never have to have a mark of a sort. But if you find that I'm starting to see something, even though I've moved the cup consistently, and I'm just starting to see a little bit of a spots of bluishness coming through, just take a warm compress, not hot, not cold, warm compress, put it on the area. Once you remove it, that should assist with it to dissipate any cup kisses. But explain to your client what a cup kiss is, that it is basically showing that deeper stagnation to a more superficial layer. And then generally they understand and they don't mind it so much. It lasts about 3 to 7 days and then it dissipates. Sorry, now I've lost track of my movements. Figure of 8 was the last one. So then we're going to do a cervical circle. So basically just going to work in this area. I'm using my super cup for this one. You can use either or. I just find this one works really well. And I'm just in a triangle, staying here on the cervical spine. We're not moving down. So just in this circular movement, we're just going round and round. Really good for someone that is at the desk quite often. For us as therapists, standing and looking over, really great one to do on yourself as well. Then I'm going to switch over to my soft body cup again. And now we're going to work on your smiles, which is just next to your scapula. So we call it our 3 smiles. So we do one side, that's one smile, right? And then your other second smile is around the neck. And your third and final smile is on your other scapula, and that's up and down. Go as low as you can next to the client and go as low as you can into the neck area as well. Okay, I think I might need to move the camera slightly for the next movement. So just bear with me quickly. Okay, see if that is correct. Yeah, so I'm going to work in this area here. Excuse me. All right. So we're going to do neck slides. So I'm standing at the top of the bed or the plinth, and what we're doing is basically you will crisscross. So my left hand is going to be pulling the cup towards the neck. Can you see well like this?
Yes.
Yeah, perfect. Thank you. And then you're simply going to take your cup. And what I also like to do is generally when you squeeze your cup, you'll squeeze it in the middle of the cup because this is where you'll have the most control over your cup. For this particular movement, you can squeeze the cup a little bit in the front, making it more of a flat opening for a smaller area to work on. Right, so squeezing a little bit more flat, and we're just going to go and pull it into the neck as much as possible. Then once I go to the other side, I'm not going to show too much on the other side now because I don't think the angle is correct at all. I'm simply taking my hand over and doing the exact same movement on the opposite side. Now we're going to do our neck circles, again, opposite hands or a crisscross hand. And I'm basically going to use this movement. This is going to be what we're doing with it. So I have my suction, and then I'm simply moving it with my left hand or my opposite hand. But my right hand, instead of doing nothing, is simply going to hold the cup at the top here so that if it drops, it doesn't drop
Not at
on
all.
the floor.
No.
Then you can simply catch it. And then the same thing applies. I'm doing a quick triangle going over to the other side. I don't think you can actually see, but then you're also doing the circles on that side. Okay. Once you're done, you can do a quick knuckle in the neck for about a minute or so. And you'll finish off your treatment with a nice hand effleurage. Okay. So before I assist my client off the bed, is there any particular movement you'd like to re-see or that you have a question about? If you do, you can just unmute yourself and quickly go ahead and ask that. Okay, perfect. I'm just going to switch off my camera quickly so I can assist my client off the bed. Here we go. Does that help?
Kisses. You just think that's so unprofessional.
Okay, perfect. Let's just grab this again.
I'm on mute.
Okay, perfect. There we go. So one of the things I do quickly also want to show you is before we continue with the information, or if you've got any questions, please feel free. But we also have our gua sha stone now for the body, which is amazing. You can use it on so many different areas. And if you are a therapist, this is a great one to also use on yourself. It's super easy. And that's why I decided I will show you on myself as well. It's super easy to control on the neck, on the areas that you are feeling uncomfortable. And with all the different areas, you've got a more rigid part, which is fantastic to break down a little bit. You've got your sleek or soft angle. You also have a nice flat area, which is great for nice circles or rotaries. And then, of course, you've got a pointy area where you can work more on a pressure point. So really good also for like reflexology on the foot. And you've also got this area. So there's lots of little hooks and nooks and where you can work on particular areas to work on various muscles and body parts that you feel the need to work on. Okay, so just a little bit more on cupping. who would I do it for? I will mostly focus on, just give me 1 second. Perfect. Okay. So who would I mostly perform cupping on? So cupping really is one of those treatments where I feel, and for those of you who've worked with cups for a long time, you'll probably agree with me, any client, unless they are contraindicated, you should be adding them to a cupping treatment or upgrading them to a cupping treatment or doing an enhancement or offering this treatment for them, because the results really are so amazing and the benefits to them are so amazing, and that's really what we want to focus on. But to mention a few things, so anyone that is struggling with cellulite, really fantastic to break that down, to detox, improving blood circulation, removing lymphatic fluid, so really good for things like MLD as well. When you do MLD, of course, you'll do very, very light suction. Asthma, sciatica, fibromyalgia, pinched nerves, sore back, sore any muscle, stomach concerns, constipation, also really nice for that. Any type of pain, it is really generally fantastic for that. If you've done sports, if you're tight, if you're stiff. I've mentioned asthma. What have I not mentioned? Oh, of course, on the skin, if we think about the skin, really fantastic to stimulate your collagen and elastin formation. Really good for minimizing fine lines and wrinkles, helping for sallow skin. And this week I've really done it a lot, but great for sinuses, just to this cloggedness, helps fantastic for that as well. Just bear in mind, if you are on medication, it could influence the way that the cups would work in terms of the if it's something that is thinning to your blood, the cup kiss will present more likely. Okay. So you're welcome to, if you want to, either in the chat, let me just open the chat so I can see that. You are welcome to either in the chat, ask me if you want to, or like I said, unmute yourself. If you've got any other things that you're not sure, can you or can you not? But I think I do want to go through the list of what you cannot, because that's a shorter list to do. So a client that is on blood thinning medication, of course, we've got clients joining on this webinar from all over the world, but in South Africa, warfarin is one of your biggest ones that they would give for blood thinning. So that unfortunately we cannot do because of the reason why you're getting the warfarin. It's probably because you're prone to blood clots, and so we don't want to be moving blood clots around. Of course, then, if you're having phlebitis, blood clots, anything that's in that sense, we do not be wanting to moving that around. Then we've got sunburn, bruises, abrasions, anything that is very just to a particular area. You can avoid that area, that's fine. If you are sunburned to a crisp all over your body, of course, then we will just avoid the treatment, unfortunately. If you are on medications like colds, flus, just make sure, again, it's going to be the blood thinning aspect of it. So something that does have blood thinning is aspirin. And we generally advise about 5 hours after you've taken it, but unless you are taking it on a regular basis, then of course it's different, because why are you taking it? Then it's something we have to look at. But otherwise, if it's something like, oh, I've got some toothache and I use some aspirin, then about 5 hours after you can do the treatment, and just be aware that the cup kiss could present a little bit darker. Bulging discs, herniated discs, organs, that's all very low area, so you'll avoid that particular area. Varicose veins we will avoid. If your client is diabetic, unfortunately, we'll avoid that as well. I often get asked why, but depending on which, and if they're taking insulin, but it can metabolize the insulin a little bit faster, and so we don't want to be doing that either. Cancer, your client needs to be in remission for about 5 years before, and that's just a big precaution really, but before we can do the treatment. And I think I've mentioned almost everything that you cannot treat, but again, if you think of something and you're not sure and you've had a client like this and you want to ask, please go ahead, put it in the chat box, unmute yourself. We can then cover that. I'm just seeing a question here in the chat box. Can someone who is fasting get the treatment done, or is it better to be performed when the person has had something to eat? We don't recommend to do it when you are fasting. So there's of course different reasons to fast. So if you are fasting either for a religious purpose or if you are fasting on a regular basis and you know when you're going to fast, I was going to say if the fasting is to a particular date and the client does it often, I would actually advise them to do cupping prior to the fast. That way, we're already getting rid of some of the toxins and some of the things that you can experience during fast, like headaches. I'm not saying that will not be there. I'm simply saying it might be less common for them. So this is something you can do before, prior to the actual fast, but not necessarily during. It would be better to be done if they've eaten something. We just don't want, so the same with something like a client that has low blood pressure. We would be very careful with the treatment. We're not saying that they cannot do the treatment, but we'll just be careful because you are lying there, and it does actually help for high blood pressure. But even high blood pressure, we want them to be on a controlled, if it's controlled, you can do it. But we don't want a client ever to feel uncomfortable once they've completed this treatment. If you do have a client that has low blood pressure and you do the treatment, we do advise that they don't actually leave the spa straight away or your salon or your treatment. They can simply, generally we've got a waiting area. If they can just relax in that area for a little bit before they continue with their day, just for everything to kind of normalize, then that's all good. So while I'm talking about that as well, I want to add that something like heat, because the cups actually generate quite a bit of heat. I'm not sure if you can actually see this, but my hands go quite red when I cup because the body of the client generally goes hotter. And so that's one of the things we don't really combine cups with heat treatments. So if a client wants to make use of a sauna or a steam room, we advise that at least 5 minutes that to finish that treatment before your cupping, because we want the temperatures just to regularize or stabilize again before we do it, and we'll certainly not do it afterwards. Then what else have I got here? The heat I've mentioned. So in that case, actually also, once your client has completed their treatment, again, we won't advise sauna or steam room, but in the same sense, we certainly don't want the client to go into, especially for those of you that's in areas that have snow or that go very, very cold. If they came in with a jacket, make sure they will wear the jacket, the scarf, the everything before they go outside again, because we don't want that kind of feeling, that quick temperature drop either, because that's uncomfortable for the client as well. And so some of the things that we will mention to our clients after the treatment is, of course, like any other treatment, we want them to drink plenty of water, stay relaxed, enjoy the day. And like I said, if they wear a jersey, jumper, anything, they just need to make sure that they put that on again before they leave the spa. If your client has had the cup kiss, I've mentioned that you can put on the warm compress in that area, noted to 3 to 7 days that it can be there. And then, of course, we would recommend home care that they can use with it. And so that's something that the Bellabaci range actually makes really easy. If you've used your Circuflow balm or your Skin Get Alive balm or your Cellulite Begone balm, you can recommend that exact one in the oleo gel formulation, which is your genie gel that the client can then purchase and use at home as well. Again, they can use just the genie, they can use just the cups, but they do work really, really great in combination with each other. I think I've said everything on my list here. Is there any other questions that you have or that often pops up from your side? I'm just going to give a few minutes so that we can do that as well. I'm not seeing anything else in the chats. Just refresh here. Okay. So what I will do is I'll say thank you so much for everyone that joining our webinar today. I hope you did find it informative and learn something new. And again, I do apologize for my voice and the coughs in between and the out of breathness. There's just some things that is out of your control. But yeah, thank you so much. But do stay behind if you do have a question. I will stay here for another minute or two if something does pop up, so that we can answer that for you.